There's a version of heart aging almost nobody talks about, and it can happen while your cholesterol, blood pressure, and standard heart scans still look normal. Most people think heart disease means plaque or blocked arteries, but there's another process happening inside the left ventricle, the heart's main pumping chamber. The issue is not whether it can squeeze, it's whether it can properly relax and fill between beats. Your left ventricle has two jobs. First, it relaxes and fills with blood. Then it contracts and pushes that blood through the body. Most routine testing focuses on the squeeze. That's what ejection fraction measures. But a normal ejection fraction does not automatically mean the heart is aging well, because it doesn't fully measure how flexible the ventricle is while filling. A healthy ventricle stretches easily, almost like a fresh rubber band. But with aging and inactivity, that tissue can become stiff. Imagine a rubber band left in a hot drawer for 15 years. It still snaps, but it no longer stretches smoothly. The same thing can happen to the heart. Pressure starts building during filling, and in more advanced cases, that pressure can back up toward the lungs, contributing to a condition called heart failure with preserved ejection fraction, where pumping looks normal, but filling is impaired. One reason the stiffness develops involves blood sugar. Heart tissue contains collagen, the structural framework that lets the ventricles stretch and recoil. Excess glucose can bind to proteins through a process called glycation, forming compounds known as advanced glycation end products, or AGEs. These AGEs cross-link collagen fibers that are supposed to slide freely past each other. Researchers often describe it like stapling the fibers together. Over time, the chamber becomes less elastic. Stiffness is influenced by many factors, including blood pressure, inflammation, and genetics, but glycation provides a direct link between metabolic health and physical heart structure. What makes this especially important is that research suggests the process is trainable. In 2014, Dr. Benjamin Levine's group at the Institute for Exercise and Environmental Medicine in Dallas published a 2-year study in the Journal of the American College of Cardiology. They followed 61 sedentary middle-aged adults and split them into two groups. One group performed structured, progressive exercise. The control group did stretching, yoga, and balance work. Researchers didn't just do a simple fitness test. They used advanced pressure and imaging measurements to directly evaluate heart stiffness. After 2 years, the exercise group increased VO2 max, basically cardiovascular fitness, by 18%. More importantly, left ventricular compliance, meaning elasticity and filling ability, improved by more than 25%. The stretching group showed essentially no improvement. A second study from McMaster University asked a more practical question. How little intense exercise is enough to produce meaningful change? Participants performed 3 20-second all-out cycling sprints with recovery periods between them, totaling roughly 10 minutes per session. After 12 weeks, VM2 max and insulin sensitivity improved comparably to a much longer traditional cardio program. It was a small study and did not directly measure long-term heart remodeling like the Dallas trial, but it strongly suggested that intensity is a powerful driver of adaptation. That matters because hard muscle contractions rapidly pull glucose out of the bloodstream, improving insulin sensitivity and reducing the conditions that promote glycation. Intensity also challenges the heart mechanically in ways that appear to improve flexibility over time. The safest approach is progressive. Start with easy walking or cardio 3 times weekly, then gradually add short intervals before eventually trying protocols like the 4x4 method. 4 minutes hard, 4 minutes easy, repeated 4 times. This video is for educational purposes only and does not constitute medical advice. If you have chest pain, dizziness, known heart disease, diabetes, high blood pressure, or you're starting intense exercise after being sedentary, talk with a qualified healthcare professional first. Follow for more science-based breakdowns on heart health, metabolism, and training. Like and subscribe.